Hello, I will be giving a presentation and elaborate a little on my recommendation on the benefits of implementing an electronic health record. I'm Janice Gresham, and this is for the University of South Alabama. Objectives. I will discuss the benefits for implementing and connecting to an electronic health record. I will also address potential problems that implementing an EHR and potential solutions. I will also talk about connecting to the healthcare information exchange. Why is implementing an electronic health record important? Why do you even need an electronic health record, you might ask yourself? Well, the government has developed what you know as the Office of the National Coordination for Health Information Technology, or ONC. It's the leader in leading health IT. It also serves as a resource to the entire health system so that we can adopt information technology. And it also promotes nationwide health information exchange to improve healthcare. The ONC is a federal and is charged with coordination of nationwide efforts to implement information and electronic exchange of health care information for consumers alike. Implementing EHRs is mandated by the government. They have a electronic health record incentives program, requirements and guidelines for meaningful use, and it has been shown to increase patient engagement in their healthcare records. Benefits of connecting an electronic record system to your facility. First, clinical. It can increase your patient identification, such as adding additional identifiers, for example, pictures, fingerprinting, scanning armbands, and palm vein scanning. Alerts to identify incorrect association, such as patients with the same name, allergies to different kind of medications. It also increases in quality, having better quality outcomes, and also helps with the standards such as national patient safety goals, such as safety. Indicators. It also helps with indicators for specific diagnoses. The electronic healthcare record can pick up the correct tests needed for certain diagnoses and help develop a power plan, put all the tests that you would order as a physician in one area so that you wouldn't miss anything. And that could be helpful so that you wouldn't come back and have to come back and add on more tests and extend the stay for the patient. It also lets you opt out of it if you didn't want a specific test, but it basically keeps the main ones in. Financial. We have a new law passed. The Patient Protection and Affordable Care Act was passed in 2010, and you get money from the insurance companies, which the ACA makes sure that these companies are being more affordable And it also reduces healthcare costs, which is good for the consumer, which will allow them to come to the hospital more. So that means you'll be given high quality care at low cost to the consumer. Efficiency. This type of electronic record makes you more functional as a facility. You can see in clinical indicators for specific tests, like I was talking about the power plan. If you have that in one area with a one-click touch and you've ordered multiple array of tests, that can make you more functional and able to go on to the next patient. You can communicate with your patients without them even coming into the hospital for follow-up. You can follow them about their labs and if they need to come in, if they need to reschedule, if they need to schedule. Patients also have the ability to view their health information online, so they're more informed, and it just increases the overall efficiency of the hospital. Well, everything has potential problems, and these have been shown of some things that you may encounter with trying to start up this electronic health record system. Participation. Most people don't like change. It's been found that most providers still find it challenging to exchange health information. It's hard for them to engage patients in using the online site. Even though they have to meet these elements in the stage 2 meaningful use incentive program. Sharing information through the health information exchange, it was low. Only 39% reporting that they could electronically share information with other providers. Even though this plays a vital and central role in delivering coordinated, accountable, patient-centered care that is less expensive and more of quality, getting people on board and excited about doing change is very hard at times. Lack of user information. If you didn't have a nurse champion or a physician champion, it could be hard to have feedback. So potential solutions to these issues is to have a nurse champion and a physician champion. These people would be your cheerleaders for the system and basically go to their coworkers and able to be a resource and bring back the information from other nurses and physicians on what should be changed and maybe what kind of worked, what did not work. Also introducing the electronic health record in steps instead of all at once makes a better situation for participation. And then it also allows feedback for adjustments, so people feel like they're a part of it and it's not something that you're just throwing at them, that they too help develop this program and they too take ownership of it, and it's almost their baby. And that concludes my presentation and recommendations on the benefits of implementing an electronic health record. I hope that you would be looking forward to implementing a health record, and it's something that you may want to add, and I think it's very beneficial because it's mandated, and as consequences with it if you're not going to do it. These are references of where I got all the information you can see here, and I thank you for your time.